I'm here with another One Beach message for you as we work our way through the various situations brought on by the COVID-19 pandemic. I plan to use these messages to talk about issues of particular concern to us here at the beach. Right now, our chief focus is on flattening the curve. We want to keep as many people as possible healthy by reducing exposure to one another. That's why we've instituted alternative instruction for the remainder of the semester, why only essential staff are on campus, which is still open and operating, and why we continue to promote social distancing to help you better understand what we're trying to do, not just on campus, but in the community at large. I'd like to bring on Dr. Kimberly Fodran, who is a physician and Chief of Medical Staff and Director of Student Health Services here at the beach. Dr. Fodran?
Hi, I'm Dr. Kimberly Fodran. Our team at the Campus Health Center has been working with Long Beach's Health Department and other public health experts since cases began emerging. We continue working with them closely as we monitor, plan, and manage the situation at the beach. For up-to-date information, I encourage you to rely on sources such as the CDC or your local health department. Right now, I want to use this time to discuss a few things that can help you or help healthcare providers and yourself, and more importantly, others. If you don't already know, Los Angeles County asks that you remain home until April 19th and that you only travel to seek medical care, conduct essential business, and run necessary errands like picking up food and medicine. Many counties, including Los Angeles, have closed parks, beaches, and trails. This is being done in order to further social distancing efforts. I cannot emphasize enough how important it is to maintain social distance. I know we like to be with our friends, give each other hugs, and hang out, but now is not the time. Stay separated. Keep the suggested 6 feet of distance between you and anyone else you see. It's critical that you adhere to these recommendations. Some other things I want to remind you of: follow the recommendations and directives from public health authorities. They have everyone's best interest in mind, and they have the best information about ways to combat this pandemic. If you're feeling ill, please remain at home. Being around sick people is not a good idea, especially at this time. If you have a cough, make sure you cover your mouth. Transporting germs with your hands to key entry points around your face, mouth, eyes, and nose is one of the most common ways people infect themselves. Hand washing is always important, but it's absolutely vital that you regularly and vigorously wash your hands during this public health crisis. Wash your hands for at least 20 seconds every time. You would be surprised how much clean hands help cut the spread of disease. You need to know that the decisions you make could save other people's lives. When it comes to the COVID-19 virus, you could have mild to no symptoms, yet pass the virus on to others, and that contact could be devastating. You may be healthy, but your behavior can have a life-threatening impact on your loved ones or others. Think of it this way: don't change your behavior to avoid being infected. Instead, act as if you have the virus and change your behavior to avoid transmitting it to anyone else. With freedom comes great responsibility. We've been given the opportunity and the responsibility to keep each other as healthy as possible. It is an act of love for our community to follow these guidelines. Thank you, and now back to President Conoley.
Thank you, Dr. Fodran. Our community is fortunate to have your expertise guiding us through this medical emergency. If we follow our doctor's orders, we have the best chances for health and for keeping the campus up and running. Again, we'll be providing updates and answering questions as we all move forward through this challenge together. Until our next get-together, be well. We are One Beach.